Retinitis pigmentosa is an ophthalmologic disease. Look at this picture, shows that normal retina and retinitis pigmentosa. OCT pictures, look at this. Fluoroscopy shows normal eyes and retinitis pigmentosa, and fluorescence angiography to examine blood vessels. Look at this detail going on. Introduction. Retinitis pigmentosa is a group of inherited eye disorders that cause progressive degeneration of the retina, the light sensitive layer at the back of the eye. It affects the photoreceptor cells, particularly the rods and cones, leading to gradual vision loss. RP primarily affects peripheral and night vision and may eventually cause complete blindness in advanced cases. While it is considered a rare disease, it significantly impacts patients' quality of life. Etymology. The term retinitis pigmentosa comes from Latin, where retinitis refers to inflammation of the retina, the light sensitive tissue at the back of the eye. Although it is now known to be a degenerative, not inflammatory condition, pigmentosa describes the dark pigment deposits that develops in the retina as the disease progresses. Definition. Retinitis pigmentosa refers to a group of genetic disorders characterized by progressive retinal degeneration, specifically affecting the photoreceptors, rods and cones, resulting in visual impairment. Types 1. Autosomal dominant RP, caused by a single defective gene inherited from one parent. It progresses slowly and is the least severe form. 2. Autosomal recessive RP. Both parents carry defective genes. This type has more severe progression. 3. X-linked RP, passed through the X chromosome. Male are more severely affected and females are carriers. 4. Syndromic RP, RP occurring alongside other systemic disorders. Example, Usher syndrome. 5. Non-syndromic RP, RP occurs without other systemic conditions. 6. Simplex RP, cases without a known family history. Causes: 1. RP is primarily caused by genetic mutations affecting the photoreceptor cells. These mutations disrupt the normal function of throats and cones, causing progressive cell death. 2. Mutations in genes such as RHO, USH2A, and RPGA are common. 3. It may be inherited in autosomal dominant, autosomal recessive or X-linked patterns. Risk factors. 1. Family history of RP or inherited genetic mutations. 2. Genetic syndromes such as Husker syndrome or Burkett-Biddle syndrome. 3. Consanguineous marriages, which increases the likelihood of recessive mutations. 4. Gender. X-linked forms primarily affect males. 5. Systemic conditions associated with syndromic RP. Complications. 1. Progressive vision loss, night blindness and tunnel vision. 2. Cataracts, common in advanced RP cases. 3. Macular edema, swelling in the macula, reducing central vision. 4. Retinal detachment. 5. Complete blindness in end stage RP. 6. Psychological distress, depression and anxiety due to visual disability. Pathophysiology of RP. 1. RP primarily affect rod cells responsible for night and peripheral vision, and later cone cells responsible for central and color vision. 2. Genetic mutations lead to the production of faulty proteins or the absence of essential proteins. 3. Photoreceptor degeneration begins in the mid-peripheral retina and progresses towards the center. 4. As cell die, the retina exhibits pigmentation, bone speckle pattern, and visual function declines. 5. Over time, the retinal pigment epithelium also become affected. The pathophysiology of retinitis pigmentosa RP involves a progressive degeneration of the photoreceptors in the retina, primarily the rods and later the cones. Here is step by step breakdowns of the process. 1. Genetic mutation. 2. Rod photoreceptor dysfunction. 3. Rod cell apoptosis, programmed cell death. 4. Accumulation of pigmented deposits. 5. Cone degeneration. 6. Retinal atrophy. 7. Clinical progression. A. Early stage night blindness and peripheral vision loss. B. Mid stage progressive tunnel vision as the visual field constricts. 6. Late stage central vision loss leading to severe visual impairment or blindness. The disease progresses slowly but inevitably. Its severity depends on the specific genetic mutation and inheritance pattern. Signs and symptoms. 1. Night blindness. Difficulty seeing in low light conditions. 2. Tunnel vision. Loss of peripheral vision. 3. Decreased visual acuity. 4. Photophobia. Sensitivity to light. 5. Difficulty with color discrimination in late stages. 6. Clumsiness, trouble navigating obstacles. 7. Bone spicle pigmentation, pigmented deposits on the retina. 8. Cataracts, clouding of the lens. 9. Muscular edema. A diagnosis. 1. Detailed patient history, family history and progression of symptoms. 2. Ophthalmologic examination. A. Fluoroscopy, bone spicle pigmentation in the retina. B. Visual field testing detects tunnel vision and peripheral loss. 5. Visual acuity test. 3. Electroretinogram ERG measures the electrical responses of rod and cones. Reduced or absent responses confirm RP. 4. Optical coherence tomography OCT identifies the retinal tinting and macular edema. 5. Genetic testing identifies mutations and determines inheritance patterns. 6. Dark adaptation test assesses difficulty adjusting to low light conditions. 7. Fluorescent angiography examines blood vessels and detects macular edema. Nursing diagnosis. 1. Impaired vision related to retinal degeneration. 2. Risk for injury related to reduced visual activity and night blindness. 3. Anxiety related to progressive vision loss and dependence. 4. Social isolation related to impaired mobility and vision loss. 5. Self-care deficit related to declining visual function. Management. First, disease management. 1. Vitamin A supplementation may slow disease progression under medical supervision. 2. Management of complications. A. Cataract surgery for lens opacification. B. Diuretics or corticosteroids for macular edema. 3. Gene therapy. Emerging therapies for specific genetic mutations. Example RPE65 gene replacement. 4. Low vision aids, magnifiers, visual devices and apps. 5. Retinal implants. Artificial retinas may provide partial vision. 6. Stem cell therapy. Experimental treatments to regenerate photoreceptors. Nursing management. 1. Educate patients and families about the disease progression and management. To assist with adaptive strategies for low vision. Example can training, lighting adjustments. 3. Encourage adherence to medical treatment and regular ophthalmologic follow-ups. 4. Provide emotional support and counseling. 5. Promote safe mobility and home safety modifications. Treatment. 1. Gene therapy. Lixtuna for RPE65 mutations. 2. Retinal prosthesis devices like the APTITUDE implant for advanced RP. 3. Pharmacological management. Vitamin A palmitate, lutein or omega-3 supplements. 4. Assistive technologies. Low vision aids, voice activated systems and mobility tools. 5. Surgical interventions, cataract extraction and management of macular edema. 6. Experimental therapies, stem cell therapy, CRI, SPR, gene editing and neuroprotective drugs. Psychosocial medicine. 1. Counseling and support groups to address depression, anxiety, isolation. 2. Orientation and mobility training, techniques for safe environment. 3. Occasional rehabilitation, assisting patients in adopting careers and learning new skills. 4. Family education and support involving caregivers to provide assistance. 5. Access to low vision assistive technologies, enhancing independency through visual tools. Prevention. While RP cannot be entirely prevented due to its genetic nature, the following measures may help. 1. Genetic counseling, identifying risk for future generations. 2. Regular eye screening for early detection and management. 4. Avoiding consanguineous marriages to reduce genetic risks. 5. Nutritional support, maintaining eye health with antioxidants and omega 3 fatty acids. In conclusion, retinitis pigmentosa is a progressive genetic retinal disorder that leads to significant vision loss over time. Early diagnosis, regular monitoring, and advancement in gene therapy and assistive technologies offer hope for improved outcomes. Comprehensive medical, nursing, and psychological management is essential to help patients maintain independence, cope with vision loss, and enhance their quality of life. Collaborative care between healthcare providers, families, and support systems plays a critical role in addressing the challenges associated with RP. Thank you. Have a nice day.